The health and medical information provided during this webinar, as well as the questions and responses from the webinar providers, are solely for informational purposes. This content is not intended to take the place of advice or treatment from health professionals. Nothing presented in the webinar is intended to be used for medical evaluation, diagnosis, or treatment. It is not intended to substitute for your relationships with your own healthcare and pharmaceutical providers. Always seek the advice of your healthcare provider before beginning any new treatment, or if you have questions regarding a medical condition.
So I'm Petar Bajic from the Cleveland Clinic. I'm the Director of Men's Health. And just as a disclosure, I am presenting as a paid speaker by Marius Pharmaceuticals for this talk. I'm also a consultant not only for Marius, but also for Endo, Coloplast, and Boston Scientific. So I'm not going to belabor this, but important safety information regarding Kyzatrex, which is the drug that we're going to be talking about today. You can review at your own leisure. Next slide. All right, so we probably have a pretty diverse group watching this. So some of you may feel very comfortable with testosterone replacement therapy, some may not. But for those that might not know, testosterone is a critical metabolic hormone. It plays a significant role in male physiology and health, and a lot of different facets that we're going to get into. There are a lot of different functions for testosterone in the body. It impacts the body in a number of different ways, everything from neurological factors like improving cognition and mood. It's important for energy level. So lack of testosterone can cause fatigue, it can cause depression, it can cause difficulty sleeping. From a cardiovascular perspective, it's essential for regulating blood flow, inflammation, and vascular function throughout the body. And men who have testosterone deficiency or a low testosterone level are going to be more likely to have cardiovascular issues, metabolic syndrome, and also type 2 diabetes. When it comes to muscle, this is probably the area I think that people are most familiar with testosterone's relationship to as we think about people using testosterone to improve lean muscle mass. But testosterone is actually essential in the body for increasing bone density and muscle mass. And it can, if your testosterone levels are low, you can get weaker, basically more brittle bones that can lead to fractures. Things like falls, et cetera, can become very devastating. When it comes to the gastrointestinal tract and the other organs, testosterone is important for motility in the colon, moving food through the digestive system. Men who have testosterone deficiency are more likely to have non-alcoholic fatty liver disease. And then from a urological standpoint, in the urinary tract and the reproductive system, it's essential for normal reproduction. And men who have a testosterone deficiency can experience low libido and erectile dysfunction. Next slide. So this is really what we're talking about today, is a chronic disease, and it's very, very prevalent. It affects millions of men around the world. Next slide. And, when surveyed about their symptoms attributable to testosterone deficiency, men report a variety of complaints. So this, was a ADAM questionnaire, which is the androgen deficiency in aging males questionnaire. It was posted to a website, and individuals were surveyed and data was collected. In this, we saw that men, a high percentage of men rated their enjoyment of life was poor or terrible. 2/3 of men felt that their strength and endurance was bad. 72% of men rated that their sports ability was poor or terrible. I mean, this just speaks to the prevalence of this condition. And, for many of these men, this can be traced back to their testosterone level not being what it used to be, perhaps, maybe related to some other medical issues or overall health problems. 76% of men rated their energy level as poor. 75% reported their libido as being an issue. Happiness level was poor or terrible in almost half of men. So really, you can see a wide range of symptoms attributable to testosterone, and really emphasizing here that these are prevalent problems. Difficulty staying awake. 59% of men after dinner, 3 to 4 times a week fell asleep before they wanted to. 53% of men felt their work performance was also poor, and 72% of men felt the strength of their erections was either somewhat or extremely weak. what is testosterone deficiency or low T? I mean, this is something that we really need to determine using a blood test. Those of you in this call that are providers and seeing patients are very familiar with this, but in order to really establish the diagnosis, it's not just having the symptoms, but you also need to have a deficient testosterone level that can explain those symptoms. Okay. Some of the tests that are used to determine that, or the most common one is a total testosterone that measures basically the overall testosterone levels in the blood. There's a more specific test called free testosterone, which is really measuring just the testosterone in the body that's available for use, that's not tied up doing other things or bound to other compounds in the body. And then sex hormone binding globulin is also important because a higher sex hormone binding globulin, or SHBG, can negatively impact how much testosterone is available to the body. So those of us that do a lot of testosterone replacement therapy, in our practice, are very familiar with using these tests to help guide decision making as far as treatments. Now, there are some kind of like optimal ranges for total testosterone. Above 300 up to 1,000 is considered optimal. This is a wide range, and there's a lot of variability, by patient age. So, younger men tend to have higher testosterone levels. So the question always becomes, is somebody who has a testosterone of 300 normal, but somebody that has a testosterone of 299 low? I don't think that it's necessarily that these ranges should be followed absolutely, but this really does provide some guidance on, where the guys who are in the lowest, maybe let's say 25% of the population fall. And then we have similar ranges for free testosterone and then SHBG, the ranges are there. So just to reemphasize, SHBG binds to testosterone and decreases free T. So you may have a normal total testosterone level, but if you have a high SHBG, your free testosterone, that most important kind of percentage of it, is going to be lower. So it's really important to kind of get that overall picture, and that's stuff that I routinely check. And there are other tests that we commonly use in testosterone patients, one of which is PSA, or prostate-specific antigen, which is a screening test for prostate cancer. It's something that's really important that we monitor while people are on testosterone replacement therapy, because testosterone levels can impact that PSA blood test. That does not mean it causes cancer. It's just something we need to keep a close eye on. Estradiol is essentially estrogens in the body. Testosterone is converted to estrogen in both men and women. So that's something that we do monitor, particularly in individuals that have, certain symptoms we can get into later. Luteinizing hormone is also something that can tell us what the cause of the testosterone deficiency is. If the luteinizing hormone is high, that suggests that the testicles are the problem, that they're not producing enough testosterone. Whereas if the luteinizing hormone is low in somebody that has a testosterone deficiency, that may point more towards the issue being higher up in the brain in the pituitary axis. Follicle stimulating hormone is primarily important for fertility. Prolactin levels also can have an impact on testosterone. And then blood counts, particularly the hemoglobin, a count of red blood cells, is an important monitoring factor that we like to follow in men who are on testosterone replacement therapy. So now I want to get into some of the common misconceptions, and honestly, I hear these all the time in my day-to-day practice, and I think these are some important things that we should clear up, particularly for those who are relatively new to the idea of testosterone and are, maybe have some misconceptions. So the first one is that testosterone replacement therapy is just for bodybuilders. So, this is a common misconception. Really, I think when it comes to bodybuilders and using androgens or testosterone or a variety of other compounds, I mean, these are usually guys that are not deficient in testosterone, so they're not treating a medical problem. They're using testosterone and other substances to try to amplify their athletic performance. And that's really not what we're talking about in this talk. Really what we're talking about is testosterone deficiency, which is a medical problem that's quite common, that can be associated with the symptoms that we talked about. And testosterone replacement therapy is essentially a treatment where we're replacing the hormone that the body is not producing. So this is really, I just want to kind of reframe the mindset around this, that this is an actual medical condition. It's very common more common than we realize, and that we can actually help these men's symptoms if they have a deficient testosterone level by making that level more into the normal range. We would expect to see that their symptoms improve. So we're not talking about something necessarily, to get you into what I call the superhuman range. That's an area where we don't really understand what's, whether it's safe or not. So we try to avoid getting guys into that range and instead try to have the target be the upper range of what we consider that normal range. The second misconception is that testosterone makes men aggressive. Really, this should never happen if you're appropriately dosing the testosterone. It's really when guys get into that way too high range, higher than a human's supposed to be, that they can start getting some of these types of symptoms. And as we'll talk about, there's some differences in the different types of testosterone. Kyzatrex, which is an oral testosterone, is particularly good because it doesn't really lead to the levels being so high that they get into the danger zone. And I think when people get their testosterone levels into that way too high zone that you might see with some of the other types of treatment options, that's when they start having some of these side effects like aggression. And if anything, testosterone replacement therapy into that normal or higher part of normal range helps to regulate mood, reducing irritability, reducing depression, etc. Okay. The next one relates to natural supplements. This is probably, I would say, the number one biggest money waster that I see guys doing in my day-to-day practice. Guys go to online or they go to the supplement store and they find these kind of testosterone boosting supplements. A lot of guys don't even really know, like, what is the definition of a supplement versus a pharmaceutical, right? So we kind of throw these words around, but what does it really mean? Really what it comes down to is the level of regulation of a pharmaceutical drug, which is something that essentially, has to either be prescribed or there are over the counters, but they have to go through a certain level of approval. And that approval is really just to demonstrate that they're safe and that they work or that they're effective for what they're being used for. Okay, whereas a supplement does not have to go through any sort of quality control or regulation whatsoever. You could literally put anything you want in a capsule, put it on a shelf as a supplement, and it does not have to go through any testing for safety, efficacy, or even, quite frankly, to actually prove what's in it. So every couple of years, you see these news articles about some supplement getting pulled off the shelf because they found out there was some sort of substance that wasn't supposed to be in it, like a pharmaceutical drug or something like that. So I generally, for the most part, encourage my patients to exercise common sense. Okay, if something sounds too good to be true as far as supplements go, it probably is. If you want to take vitamins or basic kind of stuff, amino acids, things that are in foods that we eat every day, but maybe you're not getting enough of it, I think that makes a lot of logical sense. But you're not going to find some supplement that's going to correct an underlying medical problem, just like you're not going to find a supplement that fixes diabetes. You're not going to find a supplement that fixes depression. Whatever it is, testosterone deficiency is no different. So you guys need to be really cautious about the supplements. If they have a true testosterone deficiency, a supplement is never going to get them there, unless it contains some sort of pharmaceutical drug, which quite frankly is illegal for it to do. But it is something, like I said, sometimes we hear on the news every couple of years. The final misconception that I want to cover is that testosterone replacement therapy causes heart problems and causes prostate cancer. That is absolutely wrong. There's an increasing body of really high quality research that shows that not only is testosterone safe for the heart, but it may actually help to prevent against some of the heart conditions that can happen. Meaning that if your testosterone level is deficient, it's actually more dangerous for your heart than if it's normal. Okay, and once again, we're not talking about getting that testosterone up into that superhuman range where it's not supposed to be that. We've never adequately tested to say whether it's safe or not. I cannot speak to that. But getting that into that desirable normal range, perfectly safe for the heart. And when it comes to prostate cancer, same idea. There's actually increasing evidence that having a deficient testosterone level is actually associated with the more dangerous types of prostate cancer. So that suggests that having a testosterone level in the normal range may actually be protective against the nasty, dangerous types of prostate cancer that some men can get. Now, we don't fully understand the relationship between prostate cancer and testosterone, but in general, those of us urologists who see men with testosterone deficiency, we also see men with prostate cancer. For men who have treated prostate cancer, It's something that many of us, feel comfortable actually giving those men prostate cancer, and even some men who have very low risk, non-aggressive forms of prostate cancer with close monitoring, we can actually safely treat them into that normal range, okay? And that may actually, when done carefully and safely and for the appropriate patients, may perhaps even prevent the more aggressive types of prostate cancer from forming. So probably the most important testosterone study that's come out in the past decade, just recently, not that long ago, came out. It was called the Traverse study. This was a study that was conducted at Cleveland Clinic, where I work, that essentially was the largest study ever to look at cardiovascular risk, which was the main thing they were looking at. And they also, with that study, were able to look at prostate cancer risk related to testosterone replacement therapy. The main thing that they were looking at was whether or not testosterone replacement therapy was safe for the heart, and they proved just that it is safe for the heart. Patients during that study who were on testosterone did not experience any more heart issues compared to those patients who were on a placebo or a fake treatment. So the patients didn't know which one they had. It was either the testosterone or a placebo. None of the patients had a higher risk in the testosterone group, meaning if you looked at all the testosterone patients, all the placebo patients, there was no difference in the rate of heart issues. So that was a really critical finding. And this work was, facilitated by the FDA in an effort to better clarify what that risk was. And when it comes to prostate cancer, same kind of thing. When you compared the testosterone patients to the placebo patients, there was no difference in high grade or really any prostate cancer between the two groups. So that was a really important finding that further emphasized the safety of testosterone replacement therapy, specifically when you take a guy who has a deficient level and put him into the range that's considered normal. So what are the different ways that we can get or use testosterone? Testosterone is interesting testosterone replacement therapy for testosterone deficiency is interesting compared to the treatment of many other medical conditions. Really, if you look at most other medical conditions, the first line therapy has historically always been oral medications, and then you might consider other things like injections if that doesn't work. But interestingly, for testosterone, for many years, for the past several decades, oral therapy was not really an option realistically for our patients. They had to rely on things like injections into the muscles. They had to rely on gels that have to be applied to the arm, or pellets that had to be implanted under the skin. And it's really only in the last few years that we now have oral agents like Kyzatrex available. So, it really, I think, makes a lot of sense for patients, particularly who are familiar with taking oral medications for other stuff. And as we'll talk about, it really has a lot of distinct advantages compared to other therapies. So, obviously pills can be administered orally. They don't have to be injected. They don't have to be applied to the skin. They're easy to swallow. All of these treatments are invisible, although there are some options that are actually a patch that can be visible on the skin. The gels can be pretty messy. So a lot of guys really don't like that because when you're applying this gel, it kind of is all over your hands, all over your skin, can get all over your clothes. You have to wait till it dries. There's a risk that it can transfer to other people. So that's kind of a negative about the gels that we don't see with the orals. And then certainly with any sort of injection or even the pellets, which have to be applied using a pretty invasive device, there can be pain. And with the oral medication, there is no pain, obviously. There's also several dosing options for the oral, so you can kind of tailor the dose based to the individual's needs. Certainly you can do that with the other treatments as well, but I think the oral is really the most versatile treatment option that we have. And as we'll probably get into here in a little bit, it actually probably replicates the body's natural testosterone production a little bit more than some of these other options, because the natural testosterone production in the body is kind of highest in the morning, and then by the evening it's pretty much tapered off and mostly out of your system. The oral testosterone really nicely replicates that. So as far as your body is concerned, it's probably the most natural type of testosterone replacement therapy. Whereas injections, for example, if an injection is given once every 2 weeks, you have a couple days where your levels are really, really sky high, probably much higher than they need to be and should be. And then the last couple of days, before the next injection, it's really, really low. So it doesn't really replicate that natural variation within a single day. So, we're going to continue talking about Kyzatrex here, which, like I said, a newer oral therapy for testosterone deficiency. And, many, many years ago, like decades ago, oral testosterone got a bad rap because the first generation testosterone agents did have some toxicity to the liver, but Kyzatrex is a drug that is a completely different mechanism and is not associated with any sort of liver toxicity. So we're going to talk a little bit more about testosterone or about Kyzatrex, but Kyzatrex is a drug that's meant to treat adult men who have low or no testosterone levels due to certain medical conditions. That's really important. It is a controlled substance. And it's really only been studied in adults. So that's just important to emphasize. All right, so Kyzatrex, the oral or agent we're talking about here, is up to 96% effective. This is based on a 6-month clinical trial where they looked at 139 men with low testosterone. 88% of those patients had a normal testosterone level at day 90. Okay, and based on the patients who completed the study, 96% of them achieved normal testosterone levels at day 90. These patients also experienced a 30% decrease in mean SHBG levels. So as you remember, high SHBG is bad because that means less testosterone available to the body. And with Kyzatrex, we actually see a decrease in SHBG. So more than a double increase in mean free testosterone levels in that study. Advantages we've started kind of touching on, but just to get a little more granular as far as details, it's a twice a day oral capsule taken with food, and it doesn't have to be a lot of food. It doesn't have to be any particular kind of food, but even just a little bit of food. Some people take it with just a little bit of olive oil or peanut butter or whatever, but it helps with absorption because it is absorbed through the lymphatic system. So it does need to be taken with some food. Because it's an oral medication, you don't have to worry about pain associated with injections, or if you're using gels, that it runs a risk of transferring to partners and children and things like that. There's none of that with the orals. And interestingly, it's not affected by, changes in diet. There's really nothing particular you have to do as far as like eating habits with this. And it's not affected by alcohol intake, which is another thing that people are concerned about. I mentioned the prior generations of testosterone, specifically methyl testosterone, was toxic to the liver. That is not something you need to worry about with Kyzatrex. It's a completely different mechanism. It bypasses the liver, and it's definitely not the same thing that I learned about in med school when it was oral testosterone, the original kind. There's a lot of different doses available, so you can really adjust that dose and tailor it based on your individual needs, or if you're a provider, the individual patient's needs. Looking at outcomes, this was based on a study that looked at 214 patients and what sorts of improvements or symptom changes they experienced. So when you look at psychosexual function, they reported improved desire, improved mood, more sexual activity, better erections, better erection duration. Another survey they completed called the SF36 demonstrated they had better energy, less fatigue, better general health as they perceived it, better social functioning. And then when it comes to erectile function, using the IIEF questionnaire, they were able to demonstrate that there was an improvement in erectile function, intercourse satisfaction, and orgasmic function in individuals who took Kyzatrex. So what are the most common side effects? This is certainly a big point of conversation when we're talking to men about their options for testosterone. Really, the main only one that I talk to my patients about is high blood pressure. And what we're talking about here is a really, really small increase in blood pressure, even when we see it. It only happens in about 2.6% of patients. And when we see it, it's usually just a couple points. So although it is something that happens, I would argue that it is not a clinically significant change, and that it's not something that we would really need to start somebody on a new medication or make any real adjustments for. Now, one of the most common side effects of other types of testosterone is thickening of the blood, or a rise in that hemoglobin, that blood counter, that hematocrit, which is the other number we use to look at that. That's the reason why some guys you may have heard donate blood while they're on testosterone replacement therapy. In the clinical trial for Kyzatrex, no patients had to stop taking the drug because of that issue. Okay, so we don't see as much thickening of the blood. So real quick before we get into the testimonials, why don't we see that thickening of the blood? So essentially, oral testosterone is a short-acting form of testosterone. When you take that morning dose, it lasts for, it's going to reach its peak level within a couple hours. And pretty much if you only took that one dose, by the time you're going to bed, the levels are down again. You kind of stack that with the second dose later in the day, and it gives you really nice levels during the whole day. But then at night, when you don't need that testosterone, your levels are going to come back down just like they would naturally with your body's natural rise and fall in a 24-hour period of the testosterone level. Because of that rise and fall, when we get that kind of break from the testosterone levels not being as high and being a little lower at night, that balance prevents a lot of the side effects that we see with testosterone replacement therapy, like thickening of the blood, rise in the PSA, which is that prostate blood test. Less likely that we see that with oral medications like Kyzatrex. Less likely that we see things like the testicles decreasing in size, the estrogen level going up. All that stuff is less common because what we're doing is we're replicating more naturally the body's natural testosterone production. So just a couple of testimonials from real Kyzatrex patients. The first one is from David. When I first discovered I had low T, I went with pellet therapy. While pellets seemed fine at first, they eventually became too much of a hassle. The painful implant process, scar tissue buildup, activity restrictions just weren't for me, especially when the effects started wearing off before the next dose. As soon as I heard there was an oral option, that's when I switched to Kyzatrex. I love the convenience of the capsules. My testosterone levels are in the normal range. It's made a real difference in how I feel. Another testimonial from Brian. For years, I used testosterone injections, but wanted to switch to an oral TRT. My doctor recommended Kyzatrex due to its tolerability and side effect profile, and I've now been on it for 8 months. My testosterone levels are around 700 nanograms per deciliter, and I feel just as good, if not better, on Kyzatrex than I did on injections.
All right, that brings us up to our references for the slides. So we're going to go ahead and take the slideshow down and hop into the Q&A.
Perfect. So yeah, just a couple, points. So, at this stage, it's a newer medication. Kyzatrex is not available at every pharmacy. So that link that I shared there and the phone number, which will also be available to you, is how you can get access to it. But I think starting that conversation with your primary care doctor or other provider to get some blood work checked is a reasonable first step, and then working towards getting that prescription in hand is the next step. So I'm happy to answer any questions that you guys have. Thanks for your attention. And
Alrighty, so we're going to start off with the questions that were submitted with registration. So thank you for those of you that did submit them. A few of those were just answered, including the first question about where to get your levels tested. So that works out well. Second question to start us off will be, can increasing my testosterone levels help with ED?
It's a great question. The short answer is yes, okay? But it's important to know for most men, particularly men who are in their 50s, 60s, and beyond, ED is usually primarily a blood flow problem, okay? That's a blood flow problem that happens from cardiovascular disease, hardening and narrowing of the arteries from conditions like high blood pressure, high cholesterol, diabetes, smoking, etc. Testosterone plays a part. So if you have a testosterone deficiency, it can make your erections weaker. It can also make oral medications like sildenafil, which is the generic form of Viagra, or tadalafil, which is the generic form of Cialis, it can make those less effective. So I always, in my patients who experience erectile dysfunction, check a testosterone level, especially if they don't have those risk factors, those cardiovascular risk factors. Then I feel much more confident that testosterone might be the main issue going on. But certainly anybody with a testosterone deficiency is going to get a boost in their erectile function when they get their testosterone back into the range that it's supposed to be.
Alrighty, definitely a great question. Next question here, can testosterone replacement therapies such as gel injections, oral therapies help produce or increase low semen production?
That's another great question. So semen production is also a complicated thing. So there's production and then there's how much comes out, okay? And there are a number of factors that can affect how much you're seeing come out of you when you do ejaculate. In men, particularly in men, 50 and up, the most common reason that your ejaculatory volume might be reduced is actually most commonly as a side effect of medications, like alpha blockers, like tamsulosin, which is a common prostate pill. It's probably the most common side effect, okay, causing decreased volume of semen coming out. It's also something that can happen with diabetes, okay? If those are not something that you're dealing with and you're experiencing decreased semen volume, I would say that definitely if your testosterone level is deficient, it can impact semen production, and it can impact it in a lot of ways. Testosterone is important for normal sperm production, which only makes up a small percentage of the semen, but it also impacts, the fluid produced by the prostate, probably the fluid produced by the seminal vesicles. So definitely we do see that in men who don't have another reason for having decreased volume of ejaculation, when they start testosterone replacement therapy, they might report that their semen looks more like it used to.
Okay, next question here. Once you start an oral testosterone therapy treatment plan, would you need to continue this for life or until testosterone is in the normal range?
That is such a good and important question. So testosterone replacement therapy in and of itself does not jumpstart natural production of testosterone. So just like some people have a thyroid hormone deficiency, they take thyroid hormone as an oral medication. It doesn't make their body produce more of it naturally. And in fact, if anything, it might actually, to some degree, if your dose is too high, it may de-incentivize your body from even wanting to produce more because it's already there. Why would the body work hard to make it? But what's interesting is that there's also like a lot of lifestyle factors that can contribute to testosterone deficiency. So testosterone production can be a reflection in some ways of your overall health. So if you're, eat a poor diet, you get poor sleep, you're overweight, you've got health issues, you're not taking good care of yourself, your natural testosterone production will be affected. And it can be really hard to do the things that are necessary to get yourself back in shape, to get the exercise, to get, the right kind of diet. And if your testosterone level is deficient, you're going to be struggling to get motivated. You're going to be struggling to get the weight off. So what's interesting about testosterone replacement therapy in guys like that is that it can really jumpstart your ability to get your health on the right track. And it's not uncommon that I have men on Kyzatrex who, after a period of time of being on it, and they're getting back in the gym, their relationship is doing better, they're happier, they're less depressed, they're getting a better handle on their overall health. And what we find sometimes is that as we're checking their levels, it's like they're getting higher and we're not making any changes. So we end up scaling the dosing back over time. And as long as we keep seeing those levels looking good, sometimes I can be even able to stop it. So it's not so much that it kick-started the body's natural production just from the pill, but it allowed you to kind of have some of those, important lifestyle things that can make your body more healthy and make it start working more like it's supposed to. So that doesn't always happen, but if it doesn't happen, it is something that you would be kind of, if you wanted to keep getting the benefits of it, it's something that you would be expected to be on long term, forever.
Alrighty, let's see. We're gonna ask some more questions here. So this one is asking about how Kyzatrex affects fertility or the preservation of fertility, and maybe we can answer it with Kyzatrex and TRT in general.
It's a great question. So it's really, really critical, I would say, to know that one of the side effects of testosterone replacement therapy, no matter what type you use, is that it decreases sperm production, okay? Testosterone replacement therapy is not considered an effective form of birth control for men, but it can contribute to infertility. Now, what we don't really know is what is the best testosterone approach for a guy who is trying to maintain his fertility. And there are some options of how we can boost testosterone without using testosterone replacement therapy, specifically for men who are actively trying to conceive. There's other medications that we can use that will not suppress the sperm production. Now, in general, our thought among experts in the field is that shorter acting testosterone, especially if given in a reasonable dose that's not excessively high, probably has less of a negative impact on sperm production and other factors in the body compared to the higher dose, longer acting forms of testosterone like pellets and like injections. So if I had a patient who really wanted to be on some sort of testosterone and was planning on maybe not having a kid right now, but within the next couple of years, and he wanted to know what is the type of testosterone that is going to be least likely to impact his future fertility. Although I don't have any really solid concrete science to prove it, I think most experts would agree that a short-acting testosterone like oral is going to be least likely to impact that. And there is some suggestion, some preliminary data that suggests that oral testosterone may have less of an impact on some of the hormones that come from the brain, like LH, that are then important in stimulating the testicles to, encourage them to do their thing, which is producing testosterone and producing sperm. So that's kind of the long answer. The short answer is we're not sure yet, but probably oral testosterone is the best option of the testosterones. But still, if you're planning on actively trying to have a kid, you should avoid testosterone and instead work with a fertility specialist to consider other options that are not testosterone that can boost your levels while you're actively trying to conceive. And then once you're done having kids, you can get back on testosterone, which is going to be more likely to make you feel better.
Alrighty, perfect. So talking about Kyzatrex, this person asks if this product is okay to use if you have recovered from prostate cancer. I've seen this question definitely a few times too.
Yeah, great question. I just touched on it ever so slightly during the talk. So the first disclaimer is that we don't fully understand the relationship between testosterone and prostate cancer. Okay, but the available research that's been done suggests that testosterone replacement therapy, when you're taking a guy from the low testosterone to normal, does not cause or contribute to prostate cancer. So I can speak to my own personal experience as a specialist who sees men for testosterone deficiency and also prostate cancer survivors. It makes up a big part of my practice. I feel perfectly comfortable treating testosterone deficiency in men who have treated prostate cancer, who have no evidence of, recurrence. So for example, a guy who had his prostate removed for prostate cancer and his PSA is undetectable for, a reasonably long period of time. To me, that means he does not have any more prostate cancer. I have no hesitation in treating that guy's testosterone deficiency. Even a guy who's had radiation and his PSA has looked great, it's been consistent, his radiation oncologist gave me the all clear, we can start that guy on testosterone. Where it gets a little more, tricky and requires a little closer monitoring, I think, is guys who, maybe their PSA hasn't, let's say after radiation, it has come down, but maybe rises a little bit. Those are ones where it's really ongoing conversation with the radiation oncologist to weigh the pluses and minuses, because we know that starting a guy on testosterone does increase that PSA blood test. That does not necessarily mean that it, is making cancer worse or anything like that. So we kind of have to understand the relationship between the testosterone and the PSA. And admittedly, there's a lot we still don't understand about that. Guys who are just monitoring their prostate cancer, who have a very low risk type, let's say like a grade 1 out of 5, who have a testosterone deficiency, that's somebody I'd feel comfortable treating with close monitoring. The guys where we really want to avoid testosterone are the ones who have advanced prostate cancer, where it's metastatic, it's spread to other areas of the body. That is a situation where we really want to avoid it. So the short answer is it's complicated, and I think it's best if you have prostate cancer and testosterone deficiency to have your testosterone managed by a urologist who has expertise in both conditions.
Certainly, thank you for answering that question. There was a lot of people interested in that one. Next up, we have, along the same lines, I think, kind of, because you just mentioned one case where you would not want to be taking TRT. So to continue that, who would not be a candidate for this medication?
Good question. Number one is somebody who does not have a testosterone deficiency, right? So what we're talking about here is treating testosterone deficiency, which is a medical condition. Now, going back to the beginning where I said, if you have a testosterone of 299, you're low, but if you have a testosterone of 300, are you normal? I don't necessarily feel that we need to be completely absolute about those numbers, particularly if it's somebody who's younger. You kind of, expect their testosterone to be a little higher than somebody who's older. So there is a little bit of interpretation that needs to happen if the symptoms really seem to fit. I think there's probably a little wiggle room in those ranges, depending on the comfort level of whoever's doing the prescribing. So that's one. I think people who really, really hate taking pills, like I see some of these guys out there, they've never been on a pill in their life for anything. To them, it's easier to, once every 3 to 4 months come in for a pellet implantation or something, and they don't want to have to think about taking a pill. Like that's probably not a good candidate for an oral testosterone because it is something that you have to take twice a day, and if you miss a dose, your level is going to be low. I think it's great for people who are already taking other medications, especially if they're, taking medications twice a day. They can just kind of add it into their, medications they're already taking. Who else? Let's see. Those are the main ones. Honestly, I think everybody who can get their hands on it, I think this is a great option. I wish it was the first line therapy. Maybe one day it will be, but I think it's going to take some time because it's a relatively new medication. Perhaps another one would be like somebody who has really wildly out of control blood pressure already, and they're not, taking their medications. They're not working with their doctor to take that, because Kyzatrex does have that about 2% risk of increasing blood pressure a little bit. In your average guy who's got well-controlled blood pressure, that a couple points of higher blood pressure is not a big deal, but in somebody who's really already at super higher than they should be, maybe get that under control first before starting Kyzatrex.
Certainly, and that is actually going to lead us into our next question, which was asked during the slideshow, but it's a follow-up to that blood pressure side effect. How high is too high to start with a guy that wants to get on TRT or Kyzatrex?
Yeah, good question. I think that's a conversation best had with whoever manages your blood pressure, whether it's your primary care doctor or your cardiologist. And if you don't have somebody managing your blood pressure, then you need to go and get that first. I don't remember the exact numbers from the studies, but the increase in blood pressure was like a couple points. We're talking like if you're normally 120 or over 80, you're going to go up like 123, 124. Like that's not really a clinically significant issue. But if your blood pressure is high enough to the point where you're getting symptoms from it, whatever it is, having it go a little higher may be dangerous for you. And that's a conversation that really you should have with your primary care doctor. First of all, ask them why can't we get my blood pressure better controlled? A lot of guys I see who have out of control blood pressure, it's because they don't necessarily agree with what their doctor's recommended to them. And I think the bottom line is, having high blood pressure that's out of control is eventually going to kill you. And you need to, work with your doctors to figure out something that you can do to get that under control. Because if your blood pressure is really that out of control that you can't even start Kyzatrex, you got bigger problems than testosterone deficiency.
All righty, perfect. Next question here. This person says they take 10 milligrams of tamoxifen, if I said that right, daily, and wanted to know if Kyzatrex will have fewer side effects.
I'm not sure if the question is if you take Kyzatrex in place of tamoxifen. Tamoxifen is not. What's that?
I don't know. I believe that's the question, but I'm not sure myself if those are comparable.
Yeah, I wouldn't consider tamoxifen to be a standard treatment for testosterone deficiency, which is really what we're talking about here as an indication for Kyzatrex. So I wouldn't necessarily be able to speak to, in the setting of this talk, to speak to like how Kyzatrex might be different as far as side effect profile from tamoxifen, but that's a question I could always answer offline out of the setting of this talk, which I really kind of just need to stick to the intended use of the product.
Alrighty, we appreciate it. Next question here. How long after you began a Kyzatrex treatment does it take effect to see results?
Great question. So, historically, when I've started things like injection therapy, I usually tell guys a couple months till you really start to see the benefit. But just my own personal experience in prescribing Kyzatrex, guys really start to notice a lot of improvement right away. I do think there's certain things that are more subtle that maybe take some time before you really start to appreciate it, like the mood changes and mood improvements, and things like that. So I would say you should start to notice some benefit within the first week or two, but you're really going to continue to find new benefits even for the first couple months. One of the red flag things that I didn't bring up that I think is important for guys to understand is if your testosterone level is deficient and you start testosterone and it doesn't help, or perhaps even makes things worse. One of the most commonly, I would say, underdiagnosed things that could be contributing to that is sleep apnea. Sleep apnea is a sleep disorder that impacts the way you move air while you're sleeping. Essentially, it causes you to basically suffocate. People who have sleep apnea, they snore loudly, they stop breathing while they're sleeping, they wake up feeling tired. And many men with sleep apnea that's untreated have testosterone deficiency. Why does that happen? Well, when you have sleep apnea, you do not go into the deep and restful stages of sleep, like REM sleep. And REM sleep is actually when you produce testosterone. So if you never go into REM sleep, you're not going through that phase of sleep where the testosterone is actually being produced. So you're going to have testosterone deficiency and you're going to feel like crap for two reasons. Number one, because you're not getting good sleep from the sleep apnea. And number two, because your testosterone level is deficient. The problem is if a guy has sleep apnea that's either undiagnosed or he's not willing to, listen to his doctor about doing the treatment that he's supposed to do, starting testosterone can make sleep apnea worse. So to me, it's always a red flag when we start testosterone and a guy says, hey, I don't really feel better. In fact, maybe even certain things are getting worse. Or the other red flag I see is if the blood count starts going up. To me, if the blood count starts going up, that means they have sleep apnea. It's making the sleep apnea worse. The oxygen levels are dropping while they're sleeping, and their body is smart and detects that, and it starts putting the bone marrow into overdrive and producing more red blood cells. And that's what causes the hematocrit to go up. So the take home here, if you have a sleep issue, if you snore, if you stop breathing while you're sleeping, if you've never had a sleep evaluation, talk to your primary care doctor about getting a home sleep study. If you've been diagnosed with sleep apnea, do the treatment. It's usually either a mask or a mouthpiece. You may experience a significant improvement in symptoms just from that. And the symptoms that you had attributed to testosterone deficiency may, oftentimes get better. But most importantly, even if they don't, you need that sleep apnea treatment to make that testosterone replacement therapy safer and more effective. So if you have sleep apnea and you're compliant with your treatment, whether it's your CPAP or your mouth guard or whatever it is, you're going to get the benefits of testosterone much more than if you don't, because no matter how much testosterone you're on or what your levels are, if you're not getting sleep, you're going to feel bad. You're not going to want to have sex. All of these things that we're talking about as far as symptoms, depression, etc. The symptoms are the same. So I cannot stress enough, because it's one of the most common conversations I have with my patients, the importance of sleep, the importance of, if you have sleep apnea, getting it treated, not just to feel good, but because sleep apnea is also associated with a number of horrible health conditions, and people who have untreated sleep apnea simply don't live as long. So do yourself a favor, get the sleep apnea treated, and if your testosterone level is deficient, you get that treated too, you're going to feel like $1 million. That's my rant about that for today.
Alrighty, sweet. Next question here. Is there less risk of elevated estradiol with Kyzatrex versus injections or pellet therapy?
Great question. So I will dispel another myth, okay? Estrogens are not bad. There's this weird, I don't know where this comes from, but there's this weird concept that testosterone is for boys and estrogen is for girls. And if you have estrogen as a boy, you're going to turn into a girl or something. It's just simply not true. Estrogens are critical for bone health. They're critical for normal orgasmic function. And there is for some reason, this crusade to anybody that has a slightly elevated estradiol level to add additional medications to get rid of that. And I used to do this too, because I was kind of trained to do it, but there's really no evidence to say that that's helpful or necessary. And I always ask even experts, what symptoms are getting better when you're dropping the estradiol down? Really, there's really none. If you drop the estradiol down too low, guys get osteoporosis, they get brittle bones. It's not good. So for me, the only time I worry about the estradiol level is when there are breast symptoms, breast pain or tenderness, or rarely some people can even get breast discharge. If you don't have those, I don't get too worked up about the estradiol. Now, it's important to also know that in the fat cells of the body, testosterone is converted to estrogen through a process called aromatization. Okay, so a common medication prescribed in guys whose estrogens are too high is anastrozole, which is an aromatase inhibitor. It prevents the conversion of testosterone to estradiol. So to put it in another way, the more obese a guy is, the more likely his estradiol is going to be higher because he's shunting testosterone into estradiol. We can simply just dose the testosterone to achieve a testosterone level that is where we want it to be, where he's getting good symptoms, and probably not worry that much about the estradiol unless he's having those breast symptoms, like I said. As far as different types of testosterone and how much they affect the estradiol versus how much they do not, just like what we talked about before, the higher dose, longer acting types of testosterone, like injections and pellets, are probably going to be more likely to cause a rise in the estradiol level. And perhaps, we don't know this, we need more research, but perhaps even a higher rate of breast symptoms. Whereas a short acting testosterone like Kyzatrex, where when you go to bed at night, you're pretty much down to what it would be naturally, where it's pretty low while you're sleeping. When you don't really need it, your body is kind of rebooting for the next day. You're not getting any aromatization at night, right? So your estradiol level is not going to be as impacted. But just to kind of reiterate again, I don't get worked up about estradiol. I still check it just so I see where it is in case they develop breast symptoms, but I don't kill myself to try to bring it down to the normal range because it doesn't really impact any symptoms.
Alrighty, let's see. Next question here. We got a couple questions about combining Kyzatrex with other treatments. So one is about with testosterone cypionate, and one is about using it with testosterone gels. So I know it probably depends on the desired level they're looking for, but maybe you can answer those both in one.
I probably treat thousands and thousands of guys with testosterone a year. I cannot conceive of a single situation where that would be necessary. I mean, to me, it just sounds like you're trying to hack something that really has no business being hacked. You can achieve a desirable level with Kyzatrex alone, period. There's no reason to be adding in another type of testosterone. What could possibly be better than replicating your body's natural diurnal variation in testosterone, which is going to be most closely emulated by Kyzatrex compared to other things? I really see no reason to ever combine that with another treatment, quite frankly, of any kind, but definitely not another type of testosterone.
Sweet. Alrighty. Got time for about one or two more questions here. So what is the difference between Kyzatrex and enclomiphene? And we might have touched on that a little bit, but which one is safer? They want to know.
Great question. So two different types of drugs. Okay, so there's clomiphene and enclomiphene, and then obviously testosterone, which, Kyzatrex. So clomiphene and enclomiphene work by a completely different mechanism. Okay, the way that those work, and by the way, clomiphene is FDA approved for treatment of infertility in women. It is used off-label, meaning it's not FDA approved for it, but we use it for men who have testosterone deficiency, primarily those who are actively trying to conceive or who want to preserve their fertility. Okay, that's when we use clomiphene, and enclomiphene is kind of a newer variation of that we use in the same exact way. But the way that it works is it actually blocks what's called a feedback loop of estrogens in the body on the brain. Because what happens is testosterone is converted to estrogen. And as estrogen levels rise, the brain detects that, and it basically perceives that as meaning that the testosterone levels are getting high. So it decreases testosterone production. The higher the estrogen gets, the lower the testosterone production gets. Okay, so clomiphene and enclomiphene block the ability of the brain to detect that estrogen level being high. So what happens is the estrogen level can get higher without the testosterone level being suppressed. That means the testosterone is kind of blind to that, or the brain's kind of blind to that, so the testosterone level goes up, estrogen level goes up. So what would you expect the estrogen level to be or estradiol level to be in somebody on one of those drugs? It's going to be higher than expected. That's just a normal part of how it works. In my experience with clomiphene, I think it does a very good job of making the blood levels look good. But I think most experts would agree that that patients taking clomiphene do not feel as good as guys who are taking testosterone, and we don't fully know why that is. Okay, so I think it does a good job of making the blood tests look good. I don't think it does as good of a job of making guys feel as good. In general, Clomid is considered safe. There's really not any major side effects I think are worth noting. It does increase the estradiol level, but like I said, that's not something I get too worked up about. N-clomiphene is a newer kid on the block. It's used more and more. I don't have a ton of experience with it, to be honest. There's just not a lot of patients I see in my practice that are using these drugs. But what I've heard from my colleagues who use it, more so in the infertility space, is that it maybe guys feel a little bit better on that than they do on the Clomid. And maybe it doesn't raise the estradiol up as much. But if a guy is coming to see me because he has symptoms of testosterone deficiency, unless he's like actively trying to conceive or is going to be conceiving in the near future, definitely testosterone is going to lead to more symptom improvement. Okay, so I don't really consider them as like analogous to one another, Kyzatrex versus Clomid / N-clomiphene. I really consider them treatment options for very different patients. Testosterone for guys who are not actively trying to conceive.
Alrighty, perfect. I think that explained that very well. That is going to bring us up to the end of our event, unless you would like to answer one more final roundup question I have here, which is a bit of a review.
Yeah, we could go with that one.
All right. So this one is basically a review I said, but how does one qualify for a prescription for Kyzatrex?
Great question. So qualifying for a prescription for Kyzatrex just means having testosterone deficiency. So what you need to do is, first of all, you should have some symptoms that we can attribute to testosterone deficiency, in other words, a reason for us to check it. And then we need to check a testosterone level. Like I said, should be drawn in the morning before 11 a.m. ideally. And if your level is low and the symptoms kind of fit, then you're a candidate for it. And then the move would be that we then try the medication, see how you do. If you feel like you're not having improvement in those symptoms, then I would, definitely be asking you, are there any other potential conditions that could be explaining those symptoms, like sleep apnea? And if there's not, then, we want to make sure your levels are appropriate. So we need to, once you're on treatment, check the levels, make sure that they're in that kind of desirable range, which is going to be the upper range of the normal. And I would expect you to be feeling better. If you're not, then that would probably point towards it not being a testosterone issue that's causing your symptoms. Perhaps it's a side effect of another medication or another health issue. So just to kind of, wrap it all up, I would say, if you think you might be experiencing testosterone deficiency, start the conversation with your primary care doctor, start the conversation if you want with a testosterone specialist, get the necessary testing and talk to them about Kyzatrex as an option for treating it if you have it. And, I just also want to emphasize that the importance of leading a healthy lifestyle, getting the exercise, eating a healthy diet. For men who have a testosterone deficiency, it may help to get on testosterone for a period of time to help you get your health habits in better check. And that may actually facilitate your body's natural production even more. So can't stress enough the importance of initiating that conversation. For those in the room that are, maybe more of a prescriber, do not fear prescribing oral testosterone. It's not what you learned in med school. Methyl testosterone is gone. This is a new generation, a new age. And I really think that this treatment will, hopefully in the very near future, really become the standard of care, because it's just so much better in so many ways than many of the other treatments we were having to use before this became available. So I just want to thank you very much for the opportunity to talk to you all. I want to thank MenMD and Marius Pharmaceuticals for helping to facilitate this presentation. And I look forward to continuing to spread the word on this great treatment. So thank you all again.
If you'd like to learn more about low testosterone or Kyzatrex, you do have a few options. So there will be more low testosterone resources in the Resource Center on menmd.com. You can visit this page to view instructional videos, guides, expert articles, and more. If you'd like to learn more or get started with Kyzatrex, you can do so by visiting the product page on menmd.com, where you can get started with a valid prescription today. If you still have any product-related questions, we recommend you visit Kyzatrex.com just to get answers on common questions, side effects, dosage info. And this is all on the Kyzatrex FAQ section.
If you found this video helpful and want to stay in the loop with our growing men's health community, be sure to subscribe to our channel and click the bell to be notified when new content is available. Your support makes it easier for other men like you to find these helpful resources. Thanks again for watching. We hope to see you again.